Hello, hi, good evening, everyone. I am going live with Dr. Smikle tonight from Laurel Fertility Care in San Francisco, California, and we are going to talk about male fertility as it is Male Fertility Awareness currently, and it's a super important topic which many of you have questions around. So he'll be answering all your questions about causes, issues, what that means, treatment options, emotional support, what they do at Laurel Fertility Care to support their patients who may have male fertility factor issues. So welcome everyone. Hi, lovely to see you. I'm going to get Dr. Schmeichel in now and we will take your questions and have a chat. Male fertility tonight. Hello, welcome. He should be here any second. Hello, Dr. Smikle. How are you?
I'm doing okay. How are you doing?
Yes, very well, thank you. I have given a brief introduction to our topic today,
Okay.
but for anyone who's new to us, could you please introduce yourself and tell us a little bit more about Laurel Fertility Care, and then we can go from there.
Okay. So I'm Colin Smikle. I'm the medical director of Laurel Fertility Care. We are located, our main office in San Francisco, but have our offices in Modesto and also in Oakland. And so we service primarily the upper Northern California area, but we've seen patients from all over the world in terms of helping them to build their families.
Fantastic. And I believe June marks Male Fertility Awareness, and today we will be highlighting some of the causes, how male fertility is measured, tests to diagnose, fertility treatment options, and also age and fertility for men, and importantly support out there. So could I start by asking, what are the main causes for male fertility issues? I don't want to say infertility, I'd rather say fertility issues, because I know that lots of things can be treated.
Right. So I think one thing to understand is just that the causes for male fertility are going to be many times specific ones related to if you had a vasectomy, then a reversal, or if there are issues in terms of having low sperm count, low motility, not many abnormal sperm. There could be a variety of causes for many of those things. One specific thing would be endocrine issues, which could be like hypothyroidism, hypogonadism, steroid use in the past. All those things can actually affect sperm count and lower sperm count. There are some genetic issues where cystic fibrosis, congenital absence will end up having men that were born without any sperm. Those are different in terms of they create sperm, it's just that there's not a vehicle because the path that the vas deferens that's used to basically ejaculate sperm, that's blocked, and that's blocked at birth. If you're doing it because you actually had a vasectomy, that's the same blockage, but that one's congenital, and that may be reasons why. Smoking, cigarettes, long histories of smoking. We talked about steroid use. Those are things, heat, those are things that will affect sperm. And so those are the many things that we understand that has a direct effect. There are many ones that are indirect, environmental factors, some unknown factors. So it's a broad and a pretty varied measure in terms of causing the sperm count, motility, and morphology to be affected. So
when people come to see you at Laurel Fertility Care, how soon will you evaluate the man?
As soon as possible. And the reason for that is just that, in the past, we presumed, because men make sperm every day, that, hey, you'd be making sperm, that shouldn't be a factor. So we do a lot of exploration of the female partner in a heterosexual couple, and then find out that we've actually waited for a long period of time to find out that it's his issue. So now we're very aggressive in terms of basically doing things simultaneously, or if men are partnering on in terms of trying to do things on their own, to do things immediately, because we're making no presumptions that we're dealing with normal sperm count. So that's going to be one of the first things that we do, because we want to make sure that we have a good result, and that's going to be the biggest part of everything.
Hmm. When my husband got his diagnosis of azoospermia, and so lack of sperm for people who don't know,
Mhm.
and we were waiting to find out whether it was obstructive or non-obstructive. From having done
Right,
a lot of research, we were hoping that it was obstructive because
right.
we felt that that might mean that there might be an easier fix to
Mhm.
finding sperm. Is in your um, experience, do you find higher success from men who have obstructive azoospermia versus non-obstructive?
Obstruction is an easier path to deal because essentially, just as you described, there's an obstruction to the sperm coming out. So therefore, that means you have a lot of sperm being created and made earlier in the process. So simply going, some removing the sperm sometime before that obstruction by either doing testicle aspiration or microsurgical aspiration, you can retrieve quite a few sperm. And sometimes in one sample, you'll have enough sperm that'll basically provide multiple samples for many different procedures. Now, by no means is it going to be that those sperm can be used for, say, trying to conceive naturally or with artificial insemination. The reasons for that is just that within the vas deferens, the sperm is actually created and then it matures as it goes through the process in terms of getting into the testicle, through the seminal vesicles. So many times the sperm that's actually going to be created and identified before that obstruction is going to be immature. It
Okay.
may actually have a normal form, but it's just not going to move as well. So it's one that we can identify, we can know it's sperm, but it's not one that being able to fertilize an egg
Hmm.
just naturally on its own. It'll actually have to be assisted in terms of doing that.
And is that because the head isn't very developed? I mean, what does a sperm that isn't going to fertilize an egg look like?
Well, it may just be that the head's developed, but basically the process in terms of capacitation is where the sperm, the capacity, the armament that basically drives the sperm to move the tail for it to function normally,
Right.
it's actually the mid piece. So therefore, that's the part that primarily is going to get the armament, if you will, within that maturation process. So it may be a normally shaped sperm, it's just that it just doesn't have the capacity to kind of move on its own or fertilize an egg on its own.
Hmm.
Or it may move for a while but run out of steam pretty quickly. So that's one of the reasons why you'll actually have to use more microsurgical techniques to fertilize the egg.
And if you were to use techniques such as ICSI to do that, would the sperm still be strong enough, even though it was sort of being forced to do what you would want it to do naturally?
Yes, definitely. So therefore, that's one of the things that we know, especially if it's a normal shaped sperm, fertilization is just going to be as high as if you ejaculated sperm. So therefore, that's not an issue. The issue comes in if you end up having sperm that are actually either in the earliest stages of development, so therefore, or if you actually have to retrieve it, um, you know, um, more into the testicle. The closer it gets to the testicle and the source, the more immature the sperm is, and the lower the capacity for it to fertilize. So that's where you're always going to balance, trying to get more eggs to kind of create more fertilization to occur.
And when you see patients who have tests done to see what their sperm is like, and they're not what they were hoping for, is there a different sort of level of severity, if you like, in terms of poor sperm versus better quality sperm? I mean, what's the kind of scale in terms of how you can help men with sperm?
So let's first kind of just quantify and describe what what a
Hmm.
healthy sperm is, because I think that's actually a very common question. Women, they'll make eggs. They have all the eggs they have, and they'll ovulate one egg each month. Men make sperm every day, but you'll need to actually have quite a few sperm in order to have things function naturally. The goal in terms of what we're trying to achieve in terms of talking about recommendations for treatment are going to be, well, if you have more than 5 million moving sperm in a sample, that may be great to allow someone to do intrauterine insemination or try on their own. If there's more than, say, 10 million, 100 million, that the patient may have more time in terms of basically doing a number of different things based on the partner's age. But, if it starts dropping below that threshold, then you have to start intervening more. So if it's, say, between 1 and 5 million, that's when you're going to start saying, well, IUI is going to be a better choice. IVF is even a stronger indication there. But if it's less than 1 million sperm, then IVF with ICSIs or intracytopoietic sperm injection is the only measure that you're going to allow that sperm to fertilize, just because you just don't have as many to do things naturally.
Yeah, and we've touched on azoospermia a little bit, and you mentioned that there can be sort of genetic reasons why men might have
Right.
fertility issues or be infertile, and you mentioned smoking and lifestyle. Any other causes for sperm issues?
So because men make sperm every day, one of the things that especially when you're young, it's not doesn't happen quite as often now because we don't have the incidence of mumps or measles as we did before. But that's one of the things that especially during adolescence, when you're actually having sperm develop, that's one critical time that if you develop mumps during that time, you can basically do quite a bit of damage to the testicles and to the sperm. So that's actually one common form where you'll end up having, a lot of destruction, if you will. So in those individuals, you'll see that if you looked at their hormonal profile, just because there's a lot of damage, then their FSH, the follicle stimulating hormone, same hormone we use to measure fertility in women, we also use it in men, because that's also a reflection in terms of testicular function. So those men who have really, say, a non-obstructive azoospermia, and it's due to that damage, they'll have an elevated FSH, and that means their testicles are not functioning normally. If their FSH is borderline, then you may end up basically trying to do some other measures to kind of increase that stimulation of the testicle. And so the same medicine we use in women in terms of Clomid or letrozole, you can use in men as well. And that may improve the stimulation and improve the function. It may not get it to the threshold where they can try to get pregnant naturally, but at least gets it to the threshold where they can start using, say, intrauterine insemination or IVF as a measure without having to go directly to the testicle itself. But for those extreme cases, you'll have to go directly to the testicle to get moving sperm, or there may not be any at all.
When my husband was preparing to have his microtesty operation, which was unsuccessful, I was helping him inject, I believe it was, female stimulating hormones. Would it have been intramuscular? I can't remember now. Or would it have been?
Well, so for what you described, that's even more profound in terms of, that means they were really trying to stimulate the testicles because there was some hope that there is something that's there. And it may be that you didn't have very many mature sperm in terms of ejaculate, and therefore what you're trying to do is to stimulate production. And you are going to be using intramuscular injections to kind of do that. And, the amount and the frequency is different. So therefore, sometimes you'll use HCG, or sometimes you'll just use gonal-alpha-follistatin or some other method to stimulate the testicle. So it's the same effect in terms of men in terms of what you're trying to achieve.
Yeah. And we knew due to his Klinefelter syndrome that he would need to have testosterone replacement therapy, but he was told not to have any of that before the surgery because it could potentially damage any sperm that might be there, which is fascinating, isn't it?
Well, the best way to kind of think about it is just that we're in first world countries, we're actually really, we think about things in terms of testosterone is great for muscle production, and then that's how you best think about it. But in other parts of the world, testosterone is actually used as male contraception because injecting testosterone will reduce sperm count and actually make something sterile. So in some parts of the world, that's actually a very common measure in terms of providing fertility treatment or fertility contraception for men. And so that's one of the effects. So in men who actually have low testosterone and who are using testosterone supplements, the things that they don't realize is that they're also directly affecting sperm production and sperm number, and that's pretty critical. So in those individuals who were told by their physicians that, their testosterone level is low and they need to actually have testosterone support, one of the first things that we do is to have them stop the testosterone. The unfortunate thing is just that after stopping the testosterone, then the time to when you're going to end up getting back function may be as much as 3 or 6 months. So that's a very long time in terms of trying to basically manage things, especially when you're dealing with a partner who may not have as much time.
Mm-hmm.
So that's the other thing to kind of realize.
Mm-hmm. Absolutely. What test do you use to diagnose men? Is it purely a sperm sample?
No, so we do sperm sample as the first guys, and if the sperm sample is okay, then you'll say okay, meaning that the count's normal, the morphology is normal, the motility is normal. Then you might say okay, that's a good function to start. But let's say the partner has been trying for a while, and in spite of those normal parameters, you're still not seeing an effect. Then you have to start asking different questions. Are there other things that he's doing within his lifestyle that's affecting the morphology or affecting the function? So you may end up having normal appearing sperm, but they're just not functioning normally.
Mm-hmm.
And tests that people talk about is DNA fragmentation,
Yep.
other sperm preparations in terms of trying to identify normally appearing sperm that are just not functionally normal sperm. And that's where you have those effects that come in. Many of those sperm will actually be improved with, antioxidants and other measures or other supplements. But those are the reasons why we look at the sperm really critically to try to identify what's normal.
Mm-hmm. That's great to hear. Thank you. We've had some questions. Do you mind asking some, please?
No, definitely.
I'm just going back. Sorry, just bear with me. I did see one coming earlier. I'm sorry.
That's okay.
We haven't asked it yet. Can a man reverse infertility after using steroids? Is that another word for steroids?
Steroids, yes. So let's go back to a different measure in terms of you have a lot of men who are maybe transitioning, so therefore they're going from male to female transition, or at least a lifestyle. So they'll be on estrogens to basically suppress male, phenotypes and also male production. Those individuals are also going to have effect on sperm count as well because it's going to shut down the entire axis. And the other thing that you'll see is just that function will actually be diminished for a long period of time and take a while to come back. The thing that we also note, and this goes to diet, is just that vegetarians who use a lot of tofu will also have a low sperm count. And the reason is that tofu and a lot of the soy-based products have an estrogenic effect. And so those effects are also going to lower sperm count as well. So those are things you have to ask about when you're actually, going through their history and going through their lifestyle changes that they have to kind of overcome.
Interesting. Another question. My husband had great semen analysis results, but had low testosterone. What does this mean for us?
The biggest thing it may affect is basically sex drive. So therefore, from that perspective, he has low testosterone. If his parameters are normal, he may actually just not really have the drive to basically, have intercourse as frequently as needed in order for things to work. Or, just gets tired. So therefore, from that perspective, you don't want to treat with testosterone. You might want to basically say, well, we'll kind of do start with treated insemination, where you can kind of bypass the effects of time, if you will, and the effects of basically pressure to turn to good things on a scale that you need to.
Mm-hmm. Okay, thank you for that. This is a good question. Is there a way of finding a list of natural supplements that men or women should not take that might negatively impact fertility?
The biggest thing is cigarettes. So the bottom line is that's not a supplement, but that's one of the things that people often, forget. That smoking and cigarette smoking is probably one of the worst effects both for women and men. In women, it affects quality and also affects tubal function. In men, it actually has a more profound effect in terms of sperm. It doesn't make men. It doesn't totally make them azoospermic or oligospermic, but it does diminish function. So, that's one of the things we tell them to stop it as soon as we understand and know that they're doing.
Hmm.
Along that same vein, because everyone's different, the first thing that we'll do is that they're smoking and his sperm count is actually normal. Although we'll say that, it would be better for him to cut back or reduce his consumption, he just starts out with a higher number, so therefore he can actually function. So he
Hmm.
may not have to eliminate things. So it's always going to be relative. It's not
Okay.
really an absolute. And the bottom line is trying to get a really good history so you can kind of basically make recommendations of what's going to be specific in terms of
Hmm.
doing.
Yeah.
But also avoiding anything that relates to steroid use. So one of the things that we see commonly is just that in bodybuilding and in patients who are going to gyms and working out all the time,
Yeah.
they'll actually use a lot of supplements that are not quote unquote testosterone, but there are the precursors of testosterone, and therefore they're going to be ones that convert it to testosterone and have that same effect. So we basically talk about avoiding those as well.
Okay.
Proteins are not going to be the same, so therefore you can actually use a lot of the protein supplements for workouts, but just not the testosterone or anabolic steroid-based ones.
Okay. That's good to know. Thank you. Someone said we've had a male fertility test recently done. They advised that we had no normal shaped sperm. Does this mean we can't get pregnant?
The fortunate thing is just that men make sperm every day. So if there are no normal state sperm in that one sample, the important thing would be in that what we often in that situation do, depending on the partner's age, is to start, supplements, doing the testing in terms of finding out is there other factors that may change, doing thyroid profile, doing a hormonal profile, doing prolactin, to see if we can find out what may affect that, and then retest in about 6 to 12 weeks from after that sample, because you'll end up having changes just in terms of doing that. So wouldn't use one sample as the only measure to diagnose that.
That's really good to know. Um, I wondered, for people who are trying to conceive naturally, how often should they have sex? As in, how often, how should it be every other day? Should a man be ejaculating every day?
So that one's actually going to be really important. And before answering that question, you need to actually have data. So therefore, that's where getting a sperm test is going to be really important.
Okay.
If men will always have this where they feel like they're Superman, then they actually have tons and tons of sperm. And if they do, they can have sperm every day.
Mm-hmm.
However, if there's any borderline in terms of function, morphology, or motility, then we're going to start restricting in terms of saying, well, maybe every day is too much. Because let's say you have a sperm count where the sperm count's only 30 million. If you're basically ejaculating every day, you're going to diminish that account. So therefore, you may want to have that every other day. But let's say your sperm count is 200 million. Then dropping to 50 million is not going to make a difference at all. So you can have sex more often. So that's going to be the biggest effect. It's going to come down to what the sperm count is and the function.
Does it make a difference when a sperm sample is taken, whether it's the morning, lunchtime, evening?
Um, it's best to kind of do it when you're freshest. So therefore, for most individuals, that's in the morning. It's just that during the day, you're actually other things may come up, and so therefore, it's not going to actually have as profound an effect. But those with borderline function will end up having some improvement if it's earlier in the day. But if it's a normal sperm count, it doesn't make a difference at all.
Mm-hmm.
So that's the thing. If it's normal, it really you can do anything you'd like. So life's not fair. But at the same time, if it's abnormal, you want to actually be more specific and more, determined.
When my husband had his first sperm test done and it had no sperm, he then
Mm-hmm.
had to repeat it a day or a couple of days later. And then when we went to the States to have treatment, he had to repeat it again before his surgery to see if anything had changed, maybe twice. Do you
Mm-hmm.
ever see situations where someone comes in and has a less than favourable result, not that they were expecting, and then they do it again and it's improved?
Yes. Diabetics are one where you'll end up having that, where you'll end up having, basically what we call a retrograde ejaculation. So in those individuals, they're having ejaculation, they're having sperm production, but basically when they're ejaculating, it's going directly back into the bladder. And so under those circumstances, then you'll actually have to try to figure out measures to kind of improve forward production. Some of that may be medication, that may be using others to, basically alkalize the urine so you can use that sample. But the definite situation where you might have improvement, but it all comes down to the circumstances. In most occasions, in most normal men, you shouldn't have that dramatic a change just from one day to the other.
Mm-hmm.
So no.
Mm-hmm. Okay. I'm aware of your time. We have another question, and I also want to ask you, we have quite a few questions. I'm sorry, someone just sent me a message on the side
Okay.
asking about egg quality. Please do get in touch with the team at Laurel Fertility Care, who would be happy to, arrange for you to speak to Dr. Smikle and have a consult. So he's very happy to speak with you and advise personally. In terms of age, does that impact fertility for men?
Sperm, it does affect men in several ways. Although men may make a lot of sperm and they'll make sperm throughout most of their lives, sperm function and sperm morphology and sperm motility and sperm viability diminishes over time as well.
Mm-hmm.
It doesn't follow the same change or same diminution in quality or quantity as in female fertility function, but it does diminish over time. That may actually be more into 50s, 60s, and even 70s rather than saying by 40 you're done. The thing that does change is just that, you'll end up having, a higher incidence of having some other effects. We know that after 50 or 55, basically the incidence of autism in men, in children born to men after 55 may actually increase.
Yeah.
So there may be other parameters that we're not fully aware of that are affected by age, and that's important to know.
Mm-hmm.
The motility and morphology and those things may diminish as well. It's just, again, with assisted reproduction, we can bypass many of those effects, but we can't totally eliminate the effects of age.
Absolutely. Okay, thank you. Last question. And again, if you have any more, please
That's
do
fine.
get in touch with the team. This lady's husband was told that he may have issues with his pituitary gland. It seems that his sperm count was extremely low. What sort of treatment might be available for that kind of situation?
So it depends on what the pituitary misfunction is. So we talked about getting hormone tests. So therefore, things that can actually affect sperm count would actually be, let's say he has a pituitary adenoma. That's a small benign growth inside the pituitary gland. The pituitary gland is a gland that makes prolactin, but it also makes FSH, follicle-stimulating hormone, luteinizing hormone, and all the things that stimulate the testicle. So therefore, if someone has one of those benign adenomas, then that can actually constrict the amount of cells available to make the follicle-stimulating hormone. So either treating it to reduce the size, or surgically reducing the size may improve function. So both of those things are available for those men. So that's one of the reasons why when there's a low function, we always get those tests as well.
Okay. Great. Well, thank you so much for answering all of these questions and all of your expertise today. It's very, very kind of you. There have been more questions come in. I just know that I'm just aware of your time. So please do contact the team for further help, advice. They're fabulous. They've got wonderful clinics in California, and they'd be more than happy to help you. So thank you very much, Dr. Smikle. Thanks.
Thank you for your time and everything else, and thank you for actually sharing your wealth of information with everyone. I appreciate that.
Okay, thanks. Bye-bye.
Right.
Bye, everyone.
Bye-bye.
Bye-bye.
Yeah.